somebody said that even though the e-cigarette contains lower toxic chemicals, but they said it is still harmful, which of course you have already said that this is not 100% safe.
We need to discuss about what safety means. For example, I suffer from a high blood pressure, yes? And I need to take an antihypertensive medication. Is this medication safe? According to what we know, it is safe. Well, in absolute terms, it's not at all safe. There is no medication without side effects.
Exactly.
But the benefit I will get from the medication by lowering my blood pressure is going to be much higher than the risk I have of developing the side effects. This is how safety is defined. So for me, the antihypertensive medication will be very good, of course, and beneficial. For someone who is not having a high blood pressure, it's going to be a poison.
Right.
He shouldn't take
so
it.
Shouldn't take.
So the same thing is happening with e-cigarettes. I don't even understand this discussion because it makes no sense. If it was an absolutely safe product, we would say that there is no problem for anyone, for the whole population to use it. But I've never heard any scientist suggesting that e-cigarettes should be used by everyone. But when you are talking to a smoker and you want to present the choices that he has to quit smoking, both the medications and e-cigarettes are going to have side effects, most likely.
Right.
But the benefit of quitting is going to be so huge that you accept the side effects in the same way that is happening with medicine. You accept the side effects of medications because you know that the benefit of obtaining the medication is much higher.
Right.
So in that aspect,
the
that's why I said the discussion about risks or harms for e-cigarettes is misinformative when we are talking to a smoker. It will be informative when we talk to a non-smoker, someone who has never smoked, and he's asking us whether he should start using e-cigarettes. In that case, yes, in the same way that if someone doesn't have high blood pressure,
right,
I'm not going to suggest him to take an antihypertensive medication. So it's that simple. So when you are talking to a smoker and you are discussing about the various ways, the various products he can use to quit, both for medications or for e-cigarettes, you are going to talk about the benefits of quitting with the possibility of having some minor side effects which are nothing compared to the benefits. So in that aspect, we can't discuss about harms. When we are talking to a smoker and we are telling him the harms of e-cigarettes, we are basically discouraging him from using e-cigarettes to quit, and we are basically lying by saying half the truth. So we are focusing only on potential harms. There's not even a harm established. We've never seen a vapor developing any disease because of this cigarette until now.
Exactly.
But yes, I will accept that it's not absolutely harmless. There is some residual risk that the smoker, of course, needs to be informed, but he should also be informed about the great advantages of using any cigarette compared to smoking. And this is the way of providing appropriate information. Now, discussing about the side effects is like, as I said, having a patient with high blood pressure, and the only information I'm going to tell him is that I'm going to give you this medication which causes acute renal failure, for example, acute kidney failure. He's going to immediately run away from the office, and he's not going to get the medication. Because he got an information which was not a lie, because yes, many blood pressure medications can cause kidney failure, but that's a rare side effect which you can't just discuss only about this without presenting the benefits of having someone control his blood pressure.